So I think we are in the, the participant in the room that I'm in, they can hear me. I'm here with Corey, for instance, but no other of the moderators or my co-chair. Okay, now I can see you, Bettina.
Do you see me now?
I can see you. Can you hear me?
Correct. Now I hear you very well. Yes.
That's very good. Okay, so I still miss some of the people that I need for this session.
I don't know how to manage this because we had instructed to return to the same plenary Zoom link than before. And we have sent reminders also on how to do this. But I don't know how to help. Camilla, I'm very sorry. I really don't know how to help now.
No, I see. I think they have got, because I can see both Sol and Sara in the chat, but they are not in the room in a way.
Okay, we can upgrade them to speakers. Wait a second, just a second.
Yes, and also Ola.
Yes, and also Ola all the three moderators need to be upgraded to speakers, please. Okay, I think, now we see now it's gone again. Sara, Solveig,
we got Ola in the room. So everybody, sorry about this. We are just getting the last participants into the right room, and then we will start the program again. So I think Sol and Sara, you need to specify your names in the chat so that the technicians can give you the correct rights. But I think then that maybe we should start while the technicians are working for us. So welcome back. I'm very excited to learn now. There we go, Sol is in with us. To learn a little bit more about what was happening in the work streams. I was listening in a little bit in all work streams, but couldn't be all three places at the same time. So it will be very nice now to get some 3 or 4 key messages of which lessons learned and what could be continued and strengthened in the future from the 3 work streams. And Sara, I can see you now. That's very nice. I think I then start with workstream 1. And Sara and Andre was the moderators for that workstream. So very excited to hear what you discussed and learned.
Thank you very much. Andre, if you don't mind, I will just share a couple of ideas and then please add whatever you want to that. It was really a very interesting session. We started with the question, which are the lessons learned and what could be continued, strengthening in the future. And I think we heard from Bettina's presentation yesterday that one of the priorities of the Regions for Health Network is health equity. And the experience of our participants in the work stream today was really a very good experience in the way of how to facilitate access to vaccination for people in vulnerable groups, with real examples, how they engage other sectors. And also it was mentioned that a transformative approach is required to meet all the complexity of the current situation and also to face the future challenges to achieve this the highest level of health and well-being for the whole society. And another important issue that was raised is that we need to join actions and promote policy coherence at different levels of governance with practical and collaborative actions across sectors, as we heard from some of the participants also. And also we have an experience on how to integrate equity into the regional government level, and how we need to really work on sustainable response as a recovery for this COVID-19 pandemic. I think this goes with the recommendation of the Pan-European Commission on Health and Sustainable Development, which is the investing in strong, resilient and inclusive national health systems. I don't know if Andrei would like to add something to that, please. Thank you very much.
Yes, thank you very much, Sarah. I wanted to add that in one of the presentations, it was mentioned that it is important that the head and the hands understand each other, and it's important for the different stakeholders to discuss their actions and the areas of their actions. It seems useful to me as an idea. As of today, we are facing various technical difficulties. We are working in a new, unusual format, but nevertheless, we are able to understand each other and to find solutions to the issues, which allows us to move on. So another important aspect is to have a constant dialogue between all the stakeholders. Thank you, Sarah.
Thank you so much. Really wished I had joined that work stream. Then I will ask Solveig to report from the work stream 2 about strengthening public health to enhance social resilience. Solveig?
Thank you very much, Camilla. It was amazing. I'm not so sure I will do credit to everything that has been said, but I'll give a best. I'll start with saying that preparedness, that is actually the key to everything. That will be crucial also in the future. And the elements of preparedness that were there before the crisis, they have really worked well. And there was, amongst others, in Andalusia. Which was very intriguing as well was the use of data. Used, of course, to communicate to the people, but when you look at it, this use of data and the communication becomes actually a part of the prevention strategy. People get the knowledge, they get more trust, in the government, in the public health institutions, and they might be able to better, handle their own life. So that was quite interesting also. Very interesting also, but it was always everything is interesting. The use of research into models and creating sustainable and resilient healthcare system. Really also to rely on the international, what is available there and how can you learn from it, and then use the current momentum to scale up, and definitely to scale a model up over a complete country, even from, we were talking about Moscow, and that is what they did in a very short time. That is quite impressive. I see as well the shifting competences, tasks, and training. That was something that came up regularly, and this is something that will stay. I would recommend to use also the three circles that Lydia presented on the mental health, and that was so interesting because also there we saw that we have a real clear case in North Rhine-Westphalia that is addressing one of the pillars on mental health in all ages. So it's an example of that it works. And I would say then last not least is that we're not talking about one transformation of services. It's really a change of mentality in total. Thank you.
Thank you so much, Sol. That was very clear and easy for me to take notes as well. Thank you very much. Then I think we just move on to the last work stream, last but not the least, and I give the word to Ola. Is that correct?
Yes. Hi, everyone. Thank you so very much. We had also an extremely exciting and inspiring discussion on lessons learned from COVID-19 communication. So we've discussed how important, actually, what just colleague before me said, trust is in working for the COVID-19 response, for the health emergency response, and what can contribute to building this trust. We've talked about how important the commitment from the whole government and whole society is the driver for effective risk communication and risk and community engagement, and also about the role that local authorities are playing in reaching the most vulnerable population, and how it contributes to strengthening community readiness and resilience. Colleagues from the region also shared their very great examples of what was done by them to in response to the pandemic. So how transparent and rapid communications at the community level was critical to building trust, and to making sure that people have the information they need to make decisions about their health. We also discussed the importance of and usefulness of using the insights from behavior science into communicating with communities, so identifying very specific problems, where key audiences, and engaging with them through very targeted communications, using relevant channels for them, using messengers who will resonate most with them. So it was also very great and useful. And we've also discussed the importance of journalism and in this response and in communicating with the public at the local level as well. It's critical to engage with the media, not only at the national level, but also going back to the local level, and have an effective engagement there. Over from my side. Thank you.
Okay, thank you very much. I think actually then from the first time in history, not the first time in history, but the first time of the day, we are actually in front of our schedule, which is very nice. I would just quickly give you an opportunity. Do you have any comments on the reports from each other's work streams? Something coming to mind?
Camilla, can I intervene?
Yeah, please.
Me too. I tried to listen into the several groups and the speakers, and I think it's just fantastic to learn from all of you and from the experiences which are there. My question is, I mean, while we focused on equity as saying, for example, it's one of the top priorities identified in the questionnaire we did with the Regions for Health. But emerging from the speeches before, mental health, One Health, primary health care, etc., and from what we heard, there is one area where there is a lot of experience already existing. So the question is there anything which needs to be changed? Does it need to be abolished? Does it need to be, stopped? Or are there issues you would like to strengthen? And then there are areas where we haven't done any work, even as a region for health or as a community of practice, particularly when it goes into some areas, like in the One Health area, for example, or the whole area of forecasting. I mean, there's very few institutions dealing with that, health-related, or forecasting, scenario development, etc. So then there are those areas which we might not have the skills, in the whole Regions for Health at the level, but with a little bit of upgrading, a little bit of training in some areas, we actually could be doing more, or better. So that's, and I'm still trying to sort out the interconnectivity so that it gets a red line throughout the preparedness for the next pandemic and living with COVID. Yeah. So it's not a question, it's more a comment.
I think that was more like a comment, but a very, very good one, Bettina. And I think we will take all these messages with us in the network, won't we? And look into all this information and knowledge that we are actually achieving and getting now through this meeting. I think that I would say thank you so much to the moderators for reporting back, and also thank you for everybody who participated in the work streams with presentations and comments. And I think that we can give Corey then the extra minutes actually joining us from Canada. And Andrei, you will introduce him in a more proper way than I do.
Спасибо, Камила. У нас заключительный.
Thank you, Camilla. Indeed, we have the final keynote speech, and maybe there we'll hear the responses, or we will look at possible answers. And with that, I would like to introduce Corey Neudorf. She'll be talking about. Professor will be talking about what will happen after COVID and about future public health strategies. Corey, over to you.
Yes, someone has my slides there, I hope. Excellent. Tell me if you can see them, otherwise I'll just start. There we go. Excellent. So good morning from Canada. It's been a long time since I've seen my Regions for Health Network friends. But I'm glad to be able to present an update and a reflection from my region on the impact of COVID on the future for public health. It's certainly been good to hear about some of the innovative work going on at the subnational level, although very early this morning for me. I'll go to the first slide after this, please. I think in this plenary, what I want you to do is just imagine a world in the coming months or years when the COVID situation is largely behind us and we're now starting to implement a recovery plan. But first, just a reminder of what we've faced in many countries through these past 2 years. I think it's been obvious to everybody, we've had a global recognition of the importance of public health, but yet a growing frustration as it's gone on around the public health measures and restrictions that we've been facing. We've seen some examples of good public health leadership, but quickly government has come on beside public health often, and there's sometimes been a conflation of what the public health messages are versus the actions and advice that government announces. And therefore, the messaging, the proximity of government and public health experts has been confusing in some cases. We've seen unprecedented scientific collaboration, research and development, and global solidarity with the development process and sharing of information. We've obviously experienced an overwhelming need for communicable disease control and immunization programs that have really eclipsed many other, if not all other, public health programs and services for much of the year, and a lot of our health and social support systems as well. And of course, we have a backlog now of unmet health and social needs and negative unintended consequences, or these indirect effects of COVID, as well as the indirect effects of our response to it. Next slide. This is just a framework that is from the first report that our Chief Public Health Officer in Canada released last year. And it's depicting these direct and indirect effects of COVID, as well as the COVID responses. And I just say that very quickly, for most countries, it became obvious that an all-of-government approach was required for both implementing control measures as well as mitigating these unintended consequences. And in parallel, we had health systems activating incident command centers or various emergency responses to handle the outbreak management and prepare for surges and eventually immunization programs. I'll just say as an aside that here in Saskatchewan, we were caught in a midway through a major health system restructuring when COVID hit. And so the public health system was partially dismantled at the time that COVID hit, and we had to very quickly respond with new types of emergency responses to try to meet the need. But I won't go into that in detail. Next slide. I think we've also seen many examples of trying to take a health equity approach to COVID, because the pandemic has exposed cracks in the social safety nets and have amplified pre-existing health inequities that have been present in the various societies it's been hit. So we've seen disproportionate rates of COVID cases, hospitalizations, ICU admissions, and deaths, particularly in various marginalized groups. And also people who've been left more vulnerable due to age or overcrowding or underlying medical conditions. We saw differential exposure from essential service workers who were, of course, themselves disproportionately often from disenfranchised groups, lower wage earners, recent immigrants, people who needed to take public transit or ride sharing, placing them in more contacts, often without personal protective equipment at the beginning. But it also showed how government could step in very quickly to put supports in place. And here in Canada, for example, we had income supports program that materialized that looked suspiciously like basic income programs within weeks and had a major impact in mitigating some of those negative impacts, just as an example. In my province now, we're currently in the middle of a fourth wave, and unfortunately, our government is choosing economic recovery well above further restrictions in COVID, and we're seeing now our ICU capacity stretched, despite having quite high immunization rates, but not high enough to mitigate this fourth wave. Next slide. So what happens beyond in this imagined future? I think while our province is starting to look at booster doses for those who are starting to have some waning immunity, and we're seeing breakthrough hospitalizations and ICU admissions. Meanwhile, many countries don't even have the vaccine yet. And so this idea of looking beyond wealthy countries to the global impact of COVID, because COVID obviously won't disappear until it disappears globally, or won't subside to the extent we need. So vaccine distribution and delivery globally is going to be an issue for us for some time yet. Strengthening the pandemic response capacity for coming waves and future pandemics is obviously going to be an issue. We've seen what works and what doesn't, and what do we have to shore up or make more resilient, and do that quickly. But we also need to build back stronger. And I think we have examples from both our public health systems and services where we need to do things differently, but also our health systems and our social safety nets. I think we've seen lots of examples across the world of, regardless of how much money and how much capacity was in the health system, COVID could overwhelm it. And what we need to do is look at ways to learn from that and shore up our investments in prevention and promotion services and social safety nets, rather than just say, how much more capacity do we need in health systems, as an example. Next slide. We have several reports going on that I'm participating in Canada right now that people might be interested in. We have another public health, chief public health officer report coming up in a month or two called A Vision to Transform Canada's Public Health System. And it's going to be taking some of those learnings and now trying to make the case for investment in prevention and promotion and strengthening public health systems. And I'll get into the details of that in the next slide. But we also have a report coming forward from a data advisory group called the Pan-Canadian Health Data Strategy. And it's looking at ways that we weren't able to share data and link data as quickly as possible across the country, and how do we fix that for public health into the future. We've also launched a series of consultations in the spring around learnings at a subnational level, and a report on that is coming out in the next month, as well as incorporating some of those findings into a research strategic plan for public and population health in Canada. And then lastly, our Canadian Public Health Association is using the opportunity to put together an advocacy document that local, provincial, and federal groups can use to advocate for strengthening public health. Next slide. So just a few highlights to finish off here. We need to do planning for recovery as well as for strengthening. We do need this continued response for subsequent waves and possible new variants that could come in the coming months or years. And of course, ongoing immunization needs, both locally and globally, responding to these waves. We're also simultaneously dealing with a backlog of health services, worsening chronic diseases from people who've delayed getting their normal chronic disease management and prevention programming and services. We've had this backlog or delay of disease prevention and health promotion activities, which we could be paying for a decade or more. And many examples of increased mental health and addictions issues and overdose crises here that are worsening. So we have to respond to those. But at the same time, there are calls for increased focus on improving social determinants of health and environmental determinants of health from these cracks that have been exposed. So advocating for income support programs, affordable housing, as the pandemic has shown the problems with overcrowded and unsustainable housing, employment issues, environmental health and climate change issues that this has exposed. And of course, calls for strengthening the public health system through changes in governance, funding, national public health goals and targets in many countries, data and information sharing improvements and access, as well as unheeded calls for surge capacity and workforce training that, again, this has exposed. And those are just some of the highlights that will be coming out in our Canadian report on strengthening the public health system. In our case, we have a federal system, so health is very much a provincial level decision, and a national public health system has to be cobbled together. This isn't good enough in the globalized world. We need to strengthen this at a national level. So there will be some powerful recommendations coming out, and we'll have to see if we can get them enforced. Next slide. So just in conclusion, I think as we transition out of this very intensive COVID response, public health will be facing a window of opportunity to make a case for building back stronger, both for the system itself and, of course, for the many progressive policies and programs that we work in partnership with others to try to get past things that are ultimately important to improve health and health equity. But we also face possible threats due to real and perceived financial pressures from governments that have been strained financially through this crisis, the potential for scapegoating and pushback from the population and politicians against the public health measures that people had to endure, and a rising distrust of leadership in science as from a subsegment of the population that could have some negative effects on public health as well. So I would just say that public health needs to prioritize planning for these challenges and opportunities, and the inevitable post-pandemic reviews and evaluations that are going to happen in order to maximize the chance of actually building back stronger through this crisis and take advantage of policy windows at all levels of government. Thank you.
Thank you very much, Corey. That was very interesting. I think I will just ask you one question, as I'm the chair and I can do that. do you see any possible conflicts when the regions now in the future have to kind of prioritize, maybe budget-wise, between strengthening the healthcare system, and the more medical part of future pandemics, and to build back stronger in terms of more empowered and resilient population? I mean, which usually take place outside the healthcare sector.
Yeah, definitely. I think there's certainly going to be the obvious need for shoring up capacity in ICU beds and ventilators and all of those expensive things. And what is the baseline? What is the right kind of surge capacity that's needed? I think the big thing with the pandemic has shown us is that it really doesn't matter how much of that capacity you have. It's very expensive, and you can't build enough to mitigate a wave. But what it also has shown us that there are investments that can be made for supports to decrease the proportion of people who are vulnerable, and that those are probably a better place to invest on balance. So it's not a question of either or, but it's finding the right balance and making sure that the health system doesn't bankrupt the social support system and do things in a more balanced way. But I would say leaning a little bit more toward the social support and the prevention side is, I think, the key learning for us.
Thank you so much, Corey. So please enjoy the rest of your day then in Canada. We are coming to an end, but for you it's just started. Thank you so much.
Thank you.
So we are getting close to the end, but we will try to sum up some of the key points and takeaways from this day. It has been really a very, very interesting day, and I've learned so much. I think from the plenary session that we had first thing today, what I got as takeaway messages there was that monitoring and collecting data on public health and social measure responses are really important when it comes to being more prepared for future pandemics. Furthermore, the role of the healthcare sector, and especially the primary care, is very important, and that should be strengthened. And also mental health care and attention towards mental health should be strengthened as part also of a future emergency response. Another key point, I think, from the plenary session was that we need to start thinking about human health, animal health, and the environment as one, and enforce One Health focus if we need to be more prepared in the future. Also, I think a very strong take-home lesson is that we as regions need to learn from each other's experiences. As we did today, listening to how Flanders and Moscow organized and responded to the pandemic. And I think that we as a regional network has so much to learn from each other. And then from the work streams, the first work stream was about health equity and health system strengthening. And also, as Bettina commented just before, health equity is really approaching as a very key point and was mentioned in several of the work streams. So we need to work with health equity, both in order to facilitate vaccination of vulnerable groups and all of that skepticism and all of those things. But also we need to focus on how to integrate equity into the regional strategies. Also, from work stream 1, I heard that transformative approaches are needed, and also joint actions in the future are needed, and policy coherence. And we also have to enhance understanding between the different stakeholders to move on. And I think that is always a question and something that we also discussed yesterday. How are we going to get different stakeholders to really communicate and have the common understanding on what to do in order to move on? From the work stream 2, that was about strengthening public health to enhance social resilience. I heard that you had discussed that preparedness is really the key to everything. And I'm sure that we will be better prepared if there are another pandemic in the future. But we have to kind of keep working on that preparedness. Also, the use of data and the importance of data was emphasized, both for communication to the public, and I think that was also mentioned in the work stream 3. Use of data also as a prevention strategy and as communication to the public, giving them data, transparent data, also will empower people to take right choices. Also, it was mentioned that the regions who are really close to people and maybe the first responders to situations that we have had, there is a lot of things to learn from the regions, and that could be scaled up to the national level. And it's then critical with crucial with training and training also for shifting tasks. And I think Sol said that it was really all about the change of minds, which I think was a good punchline for that work stream. And then we had the lesson learned from the COVID-19 regarding communication. And one of the key messages I heard from that work stream was building trust. And I think that is really important. And it really goes with both data and communication and how we actually communicate and are transparent with each other and with the public. I think also they mentioned that behavioral science actually could be a very important informer, what's it called, to get information from that field of science, as they know a lot about how people behave. And we need that if we are going to give the right communication and the right information to targeting the different groups. And targeted information was also one of the key points from that work stream, and that we need to think new about how to target different groups and use the right channels and the right platforms to do so. So that was some of the main key points that I have been taken with me, and I hope that you have also. And I don't know, Andrei, do you want to add something maybe from your side?
Thank you, Camilla. While listening to the presentations that I managed to listen, I can say that there are many things in common. There are many challenges that are more or less the same for regions. At the same time, when we try to apply that to Moscow, we understand that still there are some differences and there are some aspects that will not be applicable to us. And it seems to me that Regions for Health Network can conduct analysis of the most universal practices that can easily be adapted or implemented elsewhere. The practices that will be less dependent on the specifics and particularities of a particular system. I believe that it can be a good tool because some of the things that were mentioned today can be taken as such and applied in almost every region? Thank you.
Yeah, thank you. So it has been a long day and some intense hours with a lot of things to think about. I want to thank again all the contributors today in both the plenary and in the work streams. Thank you, of course, to the organizers. You really managed to get us through the day technically as well. And thank you, of course, to all the participants. It has been a pleasure to co-chair this day together with Andrei. And I think I will now give the screen to Bettina for some maybe comments of the day and some information about tomorrow, because there is also a tomorrow. Thank you.
Thanks very much, Camilla. So let me first and all give an applause to the co-chairs and to the moderators and co-moderators. So big thanks, and also a big thanks to technology, I have to say. We are surrounded, you don't see us here, but we look like a TV studio surrounded by the different specialities of technology, let's put it like this. And what I want to say is not only and thank everybody for intervening, showcasing, explaining. I think this meeting 2 years after the last meeting is a very important meeting. And I also think that the sessions on more technical aspects, like now, how can we move on under COVID and what about next emergency, is very, very important also to not only to exchange the information, but also to use the information we got from all of you. So how Moscow did deal with certain issues, a huge city, right? Compared to Canada and the discussion on public health. I mean, there is so much fertilization and synergies, as you were saying. So that I think is fantastic, and we will be trying to capitalize on that also through the meeting report, but also sharing our next round then of terms of reference. We will be sharing with you, like we did today, a one-pager. It doesn't capture the essence, of course, but we at least we try to share a one-pager of summary of the day to you, like we did with the one-pager for the day one. I mean, shout at us, tell us, no, we want this in, we want something else in. You didn't reflect us properly. Just tell us this is drafts. The further work on what is coming really out also in the detailed sessions will be further elaborated. PowerPoint presentations shared if the speakers do agree to this. Therefore, tomorrow we are going over to speak. We have the same model in terms of conference. We will have a plenary on climate change and environment and health, and we will have plenary session, then work streams, and then again a plenary session. We have a bit more time in the final plenary tomorrow for more discussion. We will try to get the technology explained maybe a bit better at the beginning of tomorrow, so that everybody understands and knows exactly where to move and when to move. That is not so easy, was not so easy to even for ourselves. But the key outcome tomorrow and the links between COVID-19 and climate change, okay, I mean, we can search for a direct link, but we have our link is the response. There is a lot of synergies on what we are doing on COVID-19 with what we need to do on climate change and vice versa. So, and that's why the convergence in action is the interesting aspect we will be also looking at, specifically then summarizing on day 4. Yes, I hope you don't disconnect. I hope it is, send us your feedback, please. I mean, whatever you want to tell us, right? That would be great, by email, by WhatsApp, by whatever, social media, whatever. Just send us your feedback on these type of meetings also, and the content and the what you learned. And then we move on, and please don't disconnect. Be connected tomorrow. I mean, disconnect tonight, of course, but let us be connected tomorrow again on climate change, and then on the day 4 on the way forward and partnership. So with this, have a wonderful morning in Canada, a wonderful night in Kazakhstan, and it's dark here outside in Moscow, and I assume the same for you in Norway, but maybe still a little bit nice in the southern part of the of the European region. So with this, wonderful day, morning, evening, and see you tomorrow. Thanks to the translators too, of course, and everybody. Ciao.